Welcome to Health Talks. I'm Gail Hogan. Kidney cancer is one of the top 10 cancers diagnosed in adults, and urologic oncologist Dr. Shawn Dason is here to share what we all should know. Dr. Dason, thank you for joining me.
Thank you for having me.
Let's start with an explanation. What is kidney cancer?
Well, the kidneys are a pretty essential organ in the body. Basically, they function to filter toxins, to manage fluids and electrolytes. And if you have cancer of one or both of your kidneys, then that's kidney cancer.
Are there different kinds of kidney cancer?
Yeah, there are. Most kidney cancers are in a big category called renal cell carcinoma, and that certainly is the most frequently diagnosed cancer of the kidneys. In general, I'd say that, we can think of kidney cancer and renal cell carcinoma as the same thing, but there are rare, uncommon, non-RCC kidney cancers. Now, within renal cell carcinoma, there are a fair number of different subtypes. All of them are different in how they're approached and managed, but I'd say most of them fall into a category we call clear cell renal cell carcinoma, with a number of less common ones like papillary, chromophobe, and even onwards from there.
So how is this kidney cancer diagnosed?
Typically, when we want to use the term kidney cancer, we want something under the microscope. So in the setting of certain situations where we do a biopsy, then we'd like a biopsy to say that it is kidney cancer. Or if we've removed a portion or all of the kidney, then that's looked at to make a diagnosis of kidney cancer. Now, we may not have, something to look at under the microscope yet, but we may have some pictures, whether it's with a CT scan or an MRI, that suggests kidney cancer. I wouldn't, strictly speaking, say that that's a diagnosis of kidney cancer, but a lot of the time that's enough to prompt us to be really concerned about kidney cancer, even if there isn't something to look at under the microscope.
I was surprised to learn that it is one of the top 10 cancers. How often is it diagnosed?
It certainly is one of the top 10 cancers. We're seeing about 30,000 cases in the US per year, and that's really increasing. And a lot of the reason that we're seeing it increase is probably because of increasing incidental diagnosis, which means that a lot more people are being diagnosed from scans that are being done for other reasons. Somebody goes in, has abdominal pain, has a CT scan, don't find a cause of the abdominal pain necessarily, but kidney cancer is then seen. So it's frequently diagnosed incidentally, and that's increasing.
Do we have any reasons for what causes kidney cancer?
Well, we know of certain risk factors for kidney cancer. We know of the underlying genetics of most kidney cancers and what genes are altered, but in an individual patient, what causes it is something we really don't know as of yet.
That has to be frustrating for you as a physician, not to be able to know a cause of a cancer.
Certainly, and it's a common question that patients do have: what caused my cancer? And we really would love to be able to answer that someday.
Can it be prevented then? Do we know that?
I think that we probably have data to say that if you reduce your risk factors for kidney cancer, it probably would prevent you from getting kidney cancer. For example, we know that high blood pressure, renal disease or renal dysfunction are both big risk factors. So if you keep that under control, then perhaps that would reduce your risk. Additionally, obesity, which is very common in our population, is another risk factor. So perhaps kind of being of more normal weight might assist with that. That being said, ultimately these are probably great to reduce your risk, but we don't have the clear data to say that we should recommend those practices routinely to kind of mitigate kidney cancer risk.
Is there a screening at all for this cancer?
Well, I think that in general, there's no routine screening recommendation for the average risk patient. There are certain familial conditions that prompt screening, and in those conditions there are distinct screening recommendations, whether it's with yearly CT scans or MRIs, or sometimes every 3 years. I think in general, though, it's a really individualized kind of assessment, and unless you have a clearly diagnosed genetic condition, there aren't routine screening practices for looking for kidney cancer in somebody without any symptoms.
You say family has something to do with this. So would you think, is it your opinion that kidney cancer is hereditary?
We definitely know there are two kind of answers to that question. So, in somebody with a particular gene that's altered, for example, von Hippel-Lindau gene or FH deficiency, those people are at very high risk of developing kidney cancer. And in those situations, there's a clear kind of hereditary nature to their kidney cancer. Separately from that, even in the absence of kind of a known gene that's altered or mutated, we know that those who have a family history of kidney cancer are at increased risk. Probably in those patients, there are genes we just haven't discovered yet, but there is also definitely a non-genetic but familial kind of risk for kidney cancer.
Can you outline some symptoms of kidney cancer?
Well, I mean, the most important thing to know is that most cases these days are diagnosed what we call incidentally, which means there are no clear symptoms. It's actually something that's found on an imaging test done for another reason. However, if you do have a large kidney tumor, there can be a number of symptoms, including blood in the urine, pain in the side, and sometimes a palpable kind of mass in the abdomen. That's the classic, again, symptom triad that's not frequently seen nowadays, but I guess something to be aware of.
Can kidney cancer spread? And if so, can it spread quickly?
Well, that's really a hard question to answer because a lot of the time the answer is no, it is not likely to spread in the short term, and it tends to be very slow growing. However, that applies mainly to what we call the small renal mass or the really small early stage kidney cancer. And a lot of the time we're able to watch those with a strategy called active surveillance, or if people have surgery or other treatments for it, then they're usually cured. Now, that doesn't apply to all kidney cancers. And in fact, those with a large renal tumor suspected to be, a locally advanced kidney cancer, those can be very highly likely to spread and can spread very quickly and progress very quickly. And so I think there's really a big spectrum of, I guess, how aggressive kidney cancer can be and how we should approach and think about it.
But you did say the word cure. So is some kidney cancers curable?
Yeah, definitely. I think there are a large number of kidney cancers that are very, very curable. And in fact, some that maybe are so indolent that they don't even need to be cured, but perhaps can be safely observed. And so there's a large proportion of very curable or observable kidney cancers.
So what are the treatment options here at Ohio State and the James?
I think that the classic kind of treatment for most kidney cancers is surgery to remove either a portion or all of the kidney. And I think we have a lot of expertise in that, performing a lot of surgeries for that indication here. Additionally, given kind of a large shift to our understanding in active surveillance or keeping an eye on many early stage kidney cancers, we're also kind of practicing a lot of active surveillance in the right setting, as well as non-surgical treatments such as ablation treatments or stereotactic ablative radiation treatment that is really coming into place as a very new and promising kind of technique in kidney cancer. Now, in the advanced setting, once the cancer has either kind of started to involve large portions of the local area or separate areas of the body, I think we have a lot of expertise in systemic therapy with medications that are either kind of there to stimulate the immune system or to target specific pathways in the cancer cells to cause them to kind of self-destruct. So I think across the whole spectrum, we see a lot of kidney cancer and have a lot of expertise in all of the current standards of care.
So are you doing any research here? And if so, can you describe some of it?
Yeah, I think we're doing a lot of research in kidney cancer. I think there's a few different arenas in which this is taking place. The first is that we have a number of clinical trials with really promising options for patients with kidney cancer. These include trials with new systemic treatments that are hopefully going to change the standard of care. These include a trial with the option for having surgery as part of treatment of their advanced kidney cancer with the thought that this may have a big role in improving outcomes based on some data we had from prior studies. Additionally, we're also doing kind of additional research in understanding what the outcomes of surgery are after a period of treatment of systemic therapy. So a vast number of different options, I think, for research in kidney cancer and really for patients to participate and get the best outcomes from those kind of advances in clinical trials and other research.
When it comes to treatment, why should a patient choose the expertise at Ohio State and the James?
Well, I think kidney cancer is ultimately, something that can be very much so thought of as a very complex cancer. There's a large kind of spectrum of the disease. There's a large kind of body of new advances that have taken place in how we treat kidney cancer. Because we see a lot of kidney cancer here, and because we have a lot of diversity of patient presentations and complexity, I think that's allowed us to get a lot of an understanding into the latest standards and most cutting-edge treatments, and so probably we are able to offer some of the best treatment because of that.
As we wind this up, Doctor, what advice or what would you like people most to know about this cancer?
Well, I think that the most important thing to know is that there's been a lot of progress in the treatment of kidney cancer. We have a lot of really great options to either cure or manage most patients with kidney cancer, and I think that a new diagnosis of kidney cancer should really hopefully be not as much of a burden as it once was, and in the future hopefully we'll kind of convert that cure to all patients.
Dr. Dason, thank you so much for sharing. And thank you for joining us for Health Talks.